Well, I'd like to welcome everybody to our monthly webinar, informational webinar for weight loss surgery in Mexico. We are honored and very happy to have you guys and have Dr. Louisiana Valenzuela from our facilities in Mexico, Tijuana. Um, I'm still waiting for everyone to join. It looks like almost everyone on board. Um, Real quick about our raffle that we do every time when we have a webinar is to make sure you have health questionnaire submitted before or today if you haven't done it before. And this raffle would be performed at the end of the webinar. So you need to have HQ and watch the webinar to the end. And Dr. Valenzuela is the surgeon that will be offering the surgery raffle. So that is a requirement. If you wonder, even if you are on the calendar for the surgery, we still honor the raffle. So as long as you haven't got the surgery, you qualify. So I like to start the webinar. My name is Ron Ellie. I'm the founder and CEO of Mexico Bariatric Center, MBC. And I have a pleasure to have Dr. Louisiana Valenzuela joining us to go over all the medical stuff that we cover today. We usually try to cover as much as possible for the questions that pretty much everyone have during our presentation. So please make sure you pay attention. And if it's not answered, we try to do this in a what we call Q&A session at the end of the webinar, toward the end of the webinar. And we try to cover as many questions as possible. Sometimes we don't get to answer every one of them. However, you can reach back out to us and ask questions, and we be more than happy to help you. So if you don't get your question answered, talk to your coordinator, call our office so we can answer the questions you have. So the topics that we're going to cover today basically is what is obesity, risks of being obese, weight loss surgery, WLS. We talk about MBC, Mexico Bariatric Center. What is it that we do? Where do we come to the picture? And then Dr. Valenzuela is going to cover different bariatric surgeries that we offer, laparoscopic, endoscopic. We talk about all the revision options and all that. And then we touch base on the bariatric vitamins after surgery. And then we open up for questions and answers at the end. And once we're done, we would do the $2,000 off raffle. Again, I'd like to welcome everyone and thank you for spending your time with us. We appreciate that. And so we all know about obesity, especially during the COVID pandemic. We realized what it means to be overweight and obese and what are the factors, risk factors. And we all know, this is actually A chronic disease is a metabolic disease, is hormonal disease, and basically is like a high blood pressure that our brain and body and hormones regulate. And of course, there are factors that we all exposed to day to day of high calorie foods, sugary drinks, conveniences, ultra processed food that human being don't have any defense against because we don't have, our body is not made like that. So of course, we talk about how genetics plays a role, how our environmental exposure makes a role, and how our developmental history is a factor. And you know, on top of everything else is our eating habits, our stress eating. Stress is a huge part of this. We're all exposed to day to day. Inadequate sleep is again another huge factor. And then the drugs that we take, those are all make us gain weight. And so in the medical field, they deal with this formula or definition called body mass index, which is BMI for short. And it basically categorizes us to where we land in this chart, whether we are over 25 BMI, which we start going to the being overweight, and then after 30, and we go on and on to morbid obesity and super morbid obesity and super morbid obesity. And here's another comment I need to make, because our center can handle all type of BMIs from pretty much from 28 to 29 special cases to over 100. And we don't have any limitations. And we require a pre-op diet for the high BMIs, but we're not like US to put so many, barriers to make you not qualify. Um, so basically, when we gain weight, so many things change in our body. Not only we gain more fat tissues, which is they call adipose tissue, the structure of the fat tissues changes, and as a result, we become insensitive to insulin. That's why diabetes type 2 come in, and so many other issues that come with gaining weight. We all know the risk factors, right? And is affecting more than 40% of adults within the US alone. This is a global issue right now. It's not just us. And I like to always show this animation to see how it affects so many of our organs, including our lungs and heart and kidney and everything else. So let's watch this. So back in the slideshow, something that we always worry about is our heart and our diabetes, but there's so many organs that can um, be affected by obesity, and one of them is kidney. Um, Kidney is a huge part of our body, and we usually just ignore it. Our focus is always like, cardiovascular, this or that. But obesity hurts everywhere, everywhere. Kidney, heart, lungs. So it's not just one place. Um, you know, all the information we get in our body. And again, in the case of coronavirus, we saw how it affected people who had obesity problems. It was basically exaggerated in those patients. And then, what is a way to get rid of this problem? So, of course, diet and exercise comes to our mind, and we all try diet and exercise. Is not a sustained, substantial weight loss solution. And then and then it comes the medications, pharmaceuticals, and so the new generation of injectables, semaglutides, all the diet pills that over years was supposed to be a magic, and those are also not long-term solution. So we need to do something to be able to lose the fat, lose the extra weight, and be safely doing it and keep it off long term. And bariatrics at this time is the only proven method to get a sustainable long term and substantial weight loss. This is what happens when we go on diet and exercise. Our body resists by decreasing our metabolism, increasing our hunger, and decreasing our satiety. And the reason, again, like we said at the beginning, is that the obesity is a metabolic disease. We all have a set point, and when we are overweight or obese, our set point is set at high. And when you go on diet and exercise, your set point, your body, your brain, your hormones try to get you back to that set point. Your body's thermostat is set at a certain weight that wants to keep operating around that weight. And when you lose weight, it's going to pull you back toward that set point. This example on my right of my screen shows like this person at 250 pounds goes on diet and exercise, and we're talking about a strict diet, eating habits changes, and we're talking about boot camp type of exercises. And let's say this person manages to lose 75 pounds. But look what happens. The hunger goes up, metabolism goes down because the body is resisting. When you get the bariatric surgery, because it changes your hormones, so let's say gastric sleeve, bypass, duodenal switch, it changes your hormones. It changes your hunger hormones and a bunch of hormones that is so complex, but it changes that hormone. As a result, your brain and hormone interaction changes, your body set point all of a sudden. Right after surgery, when you wake up, you have a different set point. Therefore, your metabolism goes up and your hunger goes down. And that's the magic for weight loss surgery. We talked about medications. Ozempic is not a long-term solution. You're basically putting hormones in your body. And, who knows what the long-term effects are. Um, there are some known effects like kidney problems, thyroid problems, maybe cancer. But again, once you stop the drug, you go back to where you were. So I like this pyramid of showing, okay, so what is the treatment for weight loss surgery? And you see that, um, again, it would work for so little people. And if you go up, you see there is endoscopic procedure, there is bariatric procedure, which is laparoscopic procedure like sleeve and bypass. And so this is the solution for weight loss. If you want permanent solution. Now it comes to, does my insurance cover this? Some insurances do, depends on the type of insurance, the type of insurance coverage you have. You may have coverage. But then even the people who have coverage, they have them go through the hoops. And at the end, the deductibles are so high. And it's basically very hard to qualify, very hard to get. And if you were to pay out of pocket, it's going to cost thousands. That's where medical tourism and MBC comes into picture. We offer low cost, high quality procedures in Tijuana, Mexico. Now, so the one thing you do your research to make sure you're comfortable with getting the bariatric surgery. This is a commitment, and is also you get that vibe that, yeah, this is a solution for me to lose weight this way. And then you look into medical tourism. Now you need to do more research to make sure the company that you connected to, you are going with, is a reputable company, is a coordination company that controls all your arrival, your pickup, transportation, coordination, and it does it seamlessly so you feel safe, you feel at peace when you go overseas or over the border to get this type of surgery. And even if you look at CDC guidelines, it tells you what to look for. Okay? And this is where MBC comes in. We've been doing this for years. And we have all the pieces together for your safety, for your peace of mind. So you travel, get the procedure, and come back. So social media is great. I need to make a comment here about social media. Social media is a great tool, but also it could be deceiving. So when you do your research, make sure you're just not looking at one company and one surgeon putting some pre-op post-op pictures that could be actually fake and just put up a website to say, well, we're the company. You need to look beyond that. You need to look beyond social media. This is your health. This is your body. This is your internal organs that getting changed. So you may want to make sure that the company you go with is not just a Facebook or an Instagram post. We are a US-based company. I myself have been involved in this industry since 2007. And NBC has been in business since 2012. We are a US corporation. Our office here in Sacramento, California. We are committed to make sure the patients are safely going and coming back, and our prices are the most affordable in the industry. These are the bullet points of why choose NBC, why us. And it probably take more time for me to go over every one of them. But again, you want to do the reviews. You want to watch the people who actually put reviews that are real. You can buy followers on social media. You can have people just post these 5-star things, but are they real? So look at the surgeons' expertise, their credentials, the packages that we offer. We see now that the industry is getting more competitive. They advertise these low prices that are not sustainable, but they are dime and nickeling, you know? Oh, this is package one, this is package two, this is package three. You get this with this, you get that with that. And then when you take you there, who knows what else the extra charges are. So we have a straightforward system. Our approval is 1, 2, 3. Our packages are very straightforward, and that's what you get. The type of procedures we offer. Dr. Louisiana is going to go over this again to explain what we offer. We don't have a procedure that we cannot perform, whether it's laparoscopic, whether it's endoscopic, whether it's high BMI, whether it's a revision of those older, outdated procedures, whether it's complex procedures like duodenal switches and all that. We offer them all. So we're not going to give you a solution that is not best for you, because we're not limited of some surgeon by himself or herself or some company that can only offer you gastric sleeve, or they can only offer you maybe gastric sleeve and gastric bypass for a BMI of under 50, because that's all they can do. And if they can't do a bypass more than BMI of 50, what they do is maybe they approve you, but they get you down there and they convince you that this is not a good solution for you, so we're going to get you the sleeve. But that's not exactly what you need. So make sure the company is capable of doing all type of surgeries, because you may be qualified for a bypass or a duodenal switch. Yeah, I know not very many people need duodenal switch, but maybe that's the best type for you. So you're making some changes to your anatomy, internal organs, that is permanent, and you want to make sure you don't get stuck with something that you don't need. We've seen that over and over. So, make sure this is not a company just formed yesterday and they have some assistant surgeon that they just hired and they're getting basically experiencing on you. We've been active in this industry, going to seminars. Now we're only doing webinars, but we used to go to Houston. We used to go to places and offer seminars for patients to know what is it that they're going through to get, what is it that we offer. And we are the ones setting the standard in this industry. We're setting the standard, so everyone else has to bring theirs, and this is the bar that they have to match. We will go over the complication rates and we'll see how low complication rates we have. And of course, the results we have, the support we have, our Facebook groups. We'll go over all that. Our surgeons load management daily. We are a Better Business Bureau A+ rated. We are Medical Tourism Association certified. We help you with FMLA. We have nutrition program that we have set years ago, and is one of the best nutrition programs you can catch out there. Or we have surgeon liaison. We'll see where the surgeon liaison comes into picture. So we have MBC has over 10 years of experience with over 20,000 successful procedures. Over. And recently, since last year, we've been offering optional medical tourism complication coverage at a very low cost. We will go over that too. We've been always visionary in this business, and like I said, we set the standard. This is a piece that hopefully this year will go live, and it would be a breakthrough in the medical tourism industry. We will have over 35,000 square feet of facility with 4 operating rooms, state of the art, with state of the art equipment, and it will be a game changer in this industry. These are some of the pictures. We are almost ready to go. We still have to refine some licenses and certifications, but other than that, we will be a world class international certified center. Sorry, I had to pass this one. It's funny, I have this coming up. This is early on. We started this project years ago, and this is during COVID when Dr. Valenzuela was visiting our starting of the project. So I mentioned NBC has over 10 years with over 20,000 patients, successful surgeries, with 6 team of surgeons. This is expertise we have. 6 team of surgeons. This is our packages, straightforward. Hotel nights, hospital nights, pre-op and post-op tests, vacation, hospital fees, transportation, the care after care, our process to get you approved. Very simple. You fill out the health questionnaire, we get the surgeon to review it. Once you get your approval, you can pay your deposit, get on the book, arrange for your travel, finish the paperwork, and you are on your way. Actually, we have automated it, so after you get your approval, you can actually go online and book yourself, and you don't even need to talk to anybody. And then just keep, doing the process until you get on the books. Facebook groups, support that you have after is huge. The surgery itself is only half of the equation. It needs to be done right, of course. And I always say, not all the gastric sleeve are the same. The gastric sleeve that Dr. Valenzuela does is not the same as some other surgeons that they offer these low prices or try to get into the industry. And so you get the support after by being into different groups we have. These are our past patients that passionately every day are helping us to help you, to support you. Sarita, she's always on the Facebook. Rena, Dawn, Kelly, Jamie, these are just our past patients in our team to help us every day. Actually, I need to mention Rena and Sarita do a podcast. So that's a really good informational channel you can get into. And it's funny because we just had a meeting last week, and she shared with us um, a presentation. Actually, everyone was in tears. I just wanted to share what she shared with us. So this is Rena before and after. And these people are working with us from their heart because they feel what it's like to be obese and what is it that NBC does. And they believe in the company, they believe in us, they believe in the surgeons, they believe in the procedure. And so the travel itself starts from when you actually, a lot of people fly to San Diego, but some people drive. And we want you to be in San Diego airport either way by 12 o'clock noon. And your departure after we release you from the hospital would be after 1 or 2 p.m. So this makes everything smoothly moving along. Again, for people who join later that are interested in participating in our raffle, basically, make sure you have a HQ in our system. And if you have submitted your HQ before, even if it's not for Dr. Valenzuela, we can switch you as long as you qualify for the procedures that Dr. B offers. And make sure you're present to the end of the webinar, and that's when we do our raffle. That will be a $2,000 off of our already low price package. Okay, why NBC? Look at the type of expertise you're getting in one place. I don't think there is a center. Well, I don't want to be ignorant, but not that I know that is a center in the world, maybe not in Mexico, that have this much expertise in one place. And Dr. Miguel Montalvo, Dr. Louisiana Valenzuela, which is our chief surgeon, Alejandro Gutierrez, Dr. Rodriguez Lopez, Jacqueline Usuna, and Jesus Ceja. I cannot tell you enough, and here's what you get by going with us. Okay? Matching prices is one thing, but look at the expertise here. You have a surgeon liaison, a bilingual doctor with 8 years of experience just with us, going through the HQs, are overlooking every HQ submitted to the surgeon, and we know which surgeon does what type of surgery to refer you to that surgeon. So we match you with the best surgeon for you, for your case, for your procedure. And there is a second eye that is looking over all these back and forth. At the end of the day, is your well-being. Just need to touch base. We touched base about pre-op diet. We don't have the pre-op diet to make sure, it's basically the purpose of our pre-op diet is to get you ready for the surgery. And the better pre-op diet you do, the better on you, the better for the surgeon. Easier on you, easier on the surgeon. And as you see, if your BMI is low, you only really need to do a 2-day clear liquid, and then it goes up from that. And basically all it is low carb, high protein diet. So this is the team. This is what you get when you go with us. We use Hyatt and alternatively Marriott, which is City Express Plus. And but right now we switched back to Hyatt again. Again, we're doing the best we can to accommodate you the best. And we don't put you places that we don't go ourselves. I go sleep in the same place when I go into Tijuana where the patients are. I go to the same places that the patients are. We send our families, we send our friends to the same place that you guys go. We don't send anybody to the places that we don't go. Dr. Valenzuela got surgery with our own team of surgeons. This is like a family. We treat you like a family. So all the medications are covered again, but you need to make sure you comply with what the instructions come from the surgeon liaison and the surgeon to stop or start whatever medications you are on. Definitely stop NSAIDs, ibuprofen at least the week before. Please stop smoking before and after. Some people I see, they don't really comply, but believe me, it's for your own best. And make sure if you're taking a medication, take that bottle with you to Mexico, even though you don't have to take it right away. We do the pre-op by doing EKG, blood tests. We don't just rely, if you had a blood test in US or EKG, we still do our own. This is our own investigation. The the This comes up all the time. The internist that actually does your pre-op checkup is an expert. He's probably done over, I don't know, maybe 40, 50,000 patients review before. So they know what criteria it is. They make sure your benefits by going through the surgery is more than your risks. Okay. And again, in the hotel, we offer included in your package jello, broth, and all that. And your companion stays in the hotel the first night with you, and they stay in the hotel when you go to the hospital. And this has been ongoing since COVID for the safety of our staff, safety of our patients, safety of everybody. Hospital. So you stay 2 or 3 nights, depends on your procedure, in the hospital, and you're ready to go back. Fly home or drive home. Why NBC? We have what we call a load management system that we control the surgeries that each surgeon does on a daily basis based on the complexity of each procedure. So we limit every surgeon based on the procedures they get. So that translates into maybe 3 to 4 surgeries per day. And that's one of the reasons our complication rates are so low, less than 1%. And we're talking about complication, we count into the wound infection, bleeding, all that stuff, which is not life-threatening. Now we get to the portion that I have to let Dr. Louisiana take over and use her expertise in this field. And I just need to mention that she's been with us since 2012. So now we're almost at 12 years with you. Thank you for all your services. She's a double board certified surgeon that you hardly find anywhere, including Mexico. Extensive training and experience. She has over 7,000 surgeries behind her. She limits her surgery every day. And one thing I need to say, this is not just to, make it like it's a commercial or advertisement. Every surgery that Dr. V does is like, that's the only surgery she wants to do on that day, because her perfection for each surgery is off the chart. So I'm going to let her take over here and talk about all the options we offer, and then talk about at least some of them. And then we take over and go over the rest of the presentation, and then we do the Q&A. Thank you so much, Dr. Valenzuela.
Hello. Today I am happy to be here with you and try to clarify all your doubts about the surgery. This is, and thank you for the words of Ron. And yes, I am working in the company and just with this company for 12 years. So I am so happy to continue here and get a lot of recommendation from the previous patients. And like Ron says, I am trying to do the best surgery for everyone. So, and try to clarify the doubts. So if you have any question, you can put in our chat to at the end of the presentation, we will start with our answers about your doubts, okay? So I will try to explain what kind of procedures we do in the hospital with different kind of patients, because not all the surgeries are for all patients. We need to choose the correct procedure for the correct patient to get better results and the less complications or issues after surgery. Because if we choose the incorrect surgery, we can have not good rates, successful rates, or we can have secondary effects from surgery like acid reflux or others. So our options are very several options are since gastric sleeve. We have in the first gastric bandit, but that was in the past. The lap band now is just to get off the lap band, get revision to other surgery. But we know how the lap band do the effect in the patients, and is the reason we need to remove the lap bands to convert to other surgery, because the lap band give to the patients a lot issues in the acid reflux or eroded lap band in the patient. So we are experts to remove these lap bands too. The gastric sleeve, the mini gastric sleeve name, it's a new name. It's talking in the social media. The patients start to name the gastric sleeve mini gastric sleeve because the number of the incisions in the abdomen. So we start to do less incisions since our experience give us those skills in the surgery. We start with 5. Some others start with 6 incisions to perform the surgeries. But year by year, we have more experience. So we start to do less incisions, 4 and 3 incisions. So the patients named the gastric sleeve mini gastric sleeve because they say, I have just 3 incisions, I had a mini gastric sleeve. But actually the technique in the stomach is the same. So we are talking the mini gastric sleeve when the patients have just 3 incisions in the tummy, in the abdomen. But the gastric sleeve technique is the same like the normal gastric sleeve with 5 incisions. The single incision gastric sleeve, the seals, is the same. It's the same technique, but through just one hole through your belly button. So it's single incision because it's just one hole, but the technique is the same. The same technique for the gastric sleeve, mini gastric sleeve, and single incision gastric sleeve. The full bypass and the mini gastric bypass, we have gastric bypass surgery for both, but in the mini gastric bypass, we have just one anastomosis. And the duodenal switch is a little more aggressive surgery with malabsorption, more malabsorption than bypass. And the SADI is the same, duodenal switch with just single anastomosis in the duodenal switch. This is a technique, a difference in the technique inside, and I will try to explain later. And all our revision surgeries. We have revision surgeries when the patients come with the lap band, with the gastric sleeve, with the mini bypass, with the full bypass, to get another surgery to resolve maybe the acid reflux. And a lot of the cases with gastric sleeve patients, they have a normal BMI maybe, or very close to normal, but they are having problems with acid reflux. Then they come to get a revision surgery of if the situation is because they regained some weight and they want to convert to other malabsorptive procedure, then they come to get a revision. The revision include to see what happened in the previous surgery, what happened in the measures, if it was too short, or if the gastric sleeve have a stretch tissue, and we can remodel the sleeve to perform a small pouch, or we can do longer the anastomosis in the gastric bypass, or just change the lap band to gastric sleeve, or to bypass, or mini bypass, or duodenal switch, depends. Okay, and we have a different endoscopic procedures like balloon, gastric balloon, and sleeve endoscopic gastrectomy, and the revision bypass like Rose or Tor, who is to put stitches over the anastomosis to reduce the weight, to stop and give you a restriction when you take the food. Okay, we will continue. Okay, we have different ways to reduce or weight and get weight loss. So of course we know the major efficacy is the surgery, and we have of course our changing our style of the life in the diet and exercise, who is the safety, but we have a lot effort in our patients and not results, or we have regain weight very, very fast, and they can't reach the goal in this way. And like Ron said, the medication and pharmacotherapy in this time are we having a lot risk, and they are in investigation still, and we are seeing the secondary effects when they are taking that hormones and the thyroids and the cells, cancer. And so we are just in that time to see what happened with that medication. So that is not the best way to try to reduce our weight. And then we have the endoscopic procedures who are good, but not enough in a lot of cases. And it's just to control some weight and not too much portions and the successful rate. And it's just when you want to give you a chance to change your habits and you don't have a lot BMI, that could result in some patients, but not in all patients who are having this fight in the obesity, with the obesity for a long time. So the bariatric surgery at the end is the perfect tool to give you the opportunity to change your habits and don't fall again in the bad habits, because the tool, it will be there and will not permit to come back to the past unhealthy life. So this is a good tool, and we need to care the tool, not just think like it's a magic all the time. If we care the tool could be forever and could be give you a healthy life forever. So this is the best option to get the weight loss and maintain your weight loss. So we'll continue. Like I tried to explain, the gastric sleeve is the popular surgery. It's the most popular surgery. We have this safest surgery too. We have a very, very close to zero complications in this surgery. And if we have any complication of this surgery, is with an easy resolutive solution. And we have a lot of experience to see what could be bad after surgery. For example, of course, the most common, I can say 0% of complication in all patients, all surgery. Any surgeons can say that, but the very low rate of complications in that rate, for example, 0.5 of complication of our patients, we know when are something wrong immediately and when we need to act fast to resolve. So this surgery, gastric sleeve, is the safest surgery and the popular surgery. We have this restriction procedure. We have the 80% off, we get off or 80% of your stomach out of your body, and we keep just your 20%. And we let like a tube, the 20%, to give to the patients the opportunity to eat with not narrow zones or stock food, but with a low amount of food, because the restriction is important. And we reach our goal in 1 year, or best numbers in 1 year. And we have the 80% of the excess of weight loss in this surgery, but in a lot of patients we have the 100% of excess of weight loss in this surgery. A lot successful rates with this, and this is a perfect tool with the patients who are volume eater and we have very good results in patients who are with problems with diabetes, high pressure, in women who have problems with syndrome of polycystic ovarium, and we have improved in the fertility with the back problems, with we are reducing the risk of cancer. We are reducing the risk to get inflammatory disease. So it's a lot improves with the weight loss, and the sleep surgery, I think, is a very good tool to the patients who are with not any other big problem like acid reflux diabetes, or who is the most important cons here. Like you can see in the table, the cons are if you have bad acid reflux, this is not the ideal surgery. And the expectations of this surgery, like the table says, is the hormones. The hormones in the top of the stomach send the signal to the brain to say if we are empty or we are full. When we remove that part, that portion of the stomach, we are getting off that hormones, and we have a better satiety signal in the brain. So we reduce the hungry in some aspects. We have different signals to who say to the brain we are hungry or not. This is one, and we are reducing the more than half of the signal to the brain to say I am not hungry. And in the process, we can do revisions very easy in this surgery, and different kind of revision. We can do mini bypass revision, we can do full bypass revision, we can do duodenal switch revisions. So this surgery, it's very respect our anatomy, respect our way to absorb the food and the vitamins, because we just reduce the size of the stomach. Okay, this is the average to do the surgery is around 1 hour, 45 minutes in some cases. We can do the surgery by single incisions, 3 incisions, 4 incisions, 5 incisions. Depends of the patients, like the Ron explained in the table. If you do a very good pre-op diet, you can have just 3 incisions, because your liver, it will be small, and we don't need the extra incisions to separate the liver. And for others, if the liver is heavy, we need the retractor. So we have these different ways to do the surgery: seals, normal incisions, 3 incisions, who are very, very good after recovery, after surgery. With less incisions, you are having less pain, less nausea, and it's a faster recovery time. Okay, so I explained this. The single incision is to patients who have less than 40 BMI. It's important to say this because this is a technically more work for us, and technical difficulty to us depends of the belly button. If the belly button is too small, well, we need to extend the incision. And we need to evaluate every patient to single incisions, but basically less than 40, they are more chance to get this kind of surgery, because over 40 it's not recommendable, because at the end maybe we can't, and we difficult technically to do the surgery, and we will finish in 3 incisions made. Okay, of course the aesthetic is the reason to get this surgery with less scars in your tummy, but the expectations are the same like regular sleeve. It's the same technique in the stomach. Okay. We will continue with the endoscopic gastro sleeve is not the same technique like the sleeve surgery. The endoscopic it's a technique to reduce the volume area in your stomach, but don't cut nothing. It's just stitches in the mucous to reduce the area of the volume in your stomach, but your stomach at the end, it will be not cutting and not removing any part, okay? And what happened with this surgery is not the same restriction. It's could open the stitch again in the future, and could have your ulcers in your stomach inside. It's to patients who absolutely don't want to remove or cut any part of the stomach, but the results are not the same like the regular sleeve. Of course, it's safer and it's faster than the normal surgery, regular sleeve, but the results are not the same. And so if you want just to lose some weight, and you can get this procedure, but it's less results, less successful rate than sleeve surgery, but safeties, and we don't cut any part. Okay, so well, the bypass is I don't like to say my preferred surgery, but it's my preferred surgery. The bypass is not for all patients. The sleeve surgery and the bypass have their own indications. The sleeve surgery I like so much because it's a safer and it's not malabsorptive surgery, and it's for younger and the extreme of the life, elders and younger people. I like more that surgery because it's not too much aggressive, and it's easier to the patient because it's less time in the hospital, and like all the pros I mentioned. But the gastric bypass, it will resolve all. It will resolve the acid reflux, it will resolve the diabetes, it will resolve the high blood pressure, it will maintain your weight loss for long term. It's malabsorptive, but not too much aggressive like duodenal switch. To me, is the perfect surgery. Of course, it's not for all patients. We have indications too, like, for example, patients who had in the past stones in their kidneys. This is not the ideal surgery because this surgery could increase that genetic disease. So, like I said, we choose the correct procedure for the correct patients. And well, this surgery change our anatomy. We do a small pouch. We put the 1.5 or meters without absorptions in that pouch to get an alimentary limb. And then down, we connect again the pelvis to absorb the rest of the fatty food. So we have 1.5 meters with not food and 1 more meter with not bellies. So we have at the end 2.5 meters with not absorption of fat food, and we have a very good results in this change in our anatomy and to resolve the diabetes and to maintain our weight loss long term and to absorb enough our nutrition to get no malabsorptive aggressive surgery. So is the reason I like so much this surgery. I like the results. I like the patients don't have issues with the acid reflux. Of course, we have some cons too. We have a chance to get a dumping syndrome, which is the most common question with this kind of malabsorptive procedures. We have this syndrome. It's control it by our diet. Okay, if we start to have some symptoms of this syndrome, is because maybe we are eating bad. We are eating a lot sugar. We are eating a lot fat foods, fried foods. So we need to be careful about our indications when we get the surgery, because we need to follow up the indications to get the best results and the best quality of life after surgery. Like this surgery, like sleeve surgery, we have indications how to eat, when you need to eat, after and before your solid food, when you need to stop the liquids, what kind and quality of food you need to eat. Because if not, we can have this syndrome, dumping syndrome, who is basically the intestine are receiving very fast the fat food, the sugar, and immediately respond to that aggressive conduct in our diet and try to expulse the food with a diarrhea, and that give us nausea, will give us low sugar in our blood, maybe a dizzy situations, and different symptoms like shakes, like we are studying, and well, different grades of dumping syndrome. The simple low symptoms and the important symptoms in the syndrome. So, but basically we can't resolve that with our conduct in our way to eat. Okay, it's a high risk of ulcers is to patients who are not stopping the smoking habits. Okay, so it's not common. It's more when the patients don't stop to smoking, we can have these ulcers, high risk ulcers in this kind of surgery. Okay, our duration in surgery, it's 1.5 to 2 hours. It's 3 nights at the hospital. It's like other surgery, 2 to 4 weeks to have the recovery time, like in normal activities. Workout is to 6 weeks, and the way to start to eat solid food is at 4 weeks. Okay, the next round. Like I said, the best surgery for me is depends how what problems I have. If I have acid reflux, if I have diabetes, how much BMI I have, if I am a sweet eater, if I am volumen eater, if I had previous ulcers in my stomach or not, if I had stones in my kidneys or no, we need to check your health questionnaire to recommend the best surgery. Maybe you put in your health questionnaire, I want the sleep, but you have some issues who are not the best way to that surgery. So we will change, or we will suggest the best option for you. Of course, at the end, you will accept or not that option, and but we try to work together to choose and choose the best decision for you. Depends how are your habits and what disease you have, diabetes, high pressure, your age, and etc. Okay. Next, please. So mini gastric bypass is the same malabsorption surgery like full bypass, but in this surgery, we try to do a longer pouch to do the anastomosis 2.5 meters down, but with a single anastomosis. Just that anastomosis it will be. And the longer pouch is to reduce the possibility to have bilious reflux in your esophagus. At the end, we still have that minimal percent or risk to get to have bilious reflux in your esophagus. Yes, this is a technically to avoid that possibility, but still we can have that issue after the mini gastric bypass. Why choose the mini gastric bypass? Well, we have a safety surgery because it's just one anastomosis. We have the opportunity to give you in a high BMIs to get a malabsorption surgery because we have technically most chance to perform this anastomosis when your heavy intestines are not enough free to move in the technique to perform the full bypass. We have this option to give you the chance to get the malabsorption surgery and improve your weight loss. And at the end, at years, if something happened with the bilis or something, we have the option to convert to the full bypass surgery in our region. But when you are in the safety condition to get the full bypass and don't have any technical problem because your BMI is too high, sometimes we need to consider that, and we have this perfect option to give you that possibility to lose all the weight in a safety surgery. Okay. This is malabsorptive, like full bypass, resolving the diabetes, the high blood pressure, is less time in the surgical room, 1.5 hours in the surgical room, is the same a hospital study, 3 nights, and the same recovery time. For the bypass and mini bypass, we are using a drain tube just to check everything is good. One day, 24 hours, we will see if all is clear, we'll remove the drain. To sleeve surgery, in my case, I am not using a drain tube. So that is giving us a faster recovery time, less chance to get any complication in your lungs, because when we have the drain, we are breathing more superficial, and when we don't have that drain, we are pushing to the patient to the exercise breathing, and they open more the lungs, and we don't have any chance to get any complication in the lungs, like the last maybe 5 to 8 years, we are having a very good fast recovery time with any clot, any atelectasia, who is the collapse in the lung, and we are active the patients to walk immediately after surgery with the compressive socks, with the exercise breathing, and we don't have any. And that is the best recovery time and give us the close to zero complication after surgery. Okay. Okay, we will pass the next slide. Okay, and the same. What is the best, gastric bypass or mini gastric bypass? It's the same. Depends your BMI, depends. If you have acid reflux, I will not recommend the mini bypass. For sure, is the full bypass the best option. For scar tissue or heavy fat tissue in your tummy, the safer procedure is mini bypass. If you have some condition who we need to do less time in the surgical room, because we need to be under less time in the anesthesia for whatever situation, lungs, previous disease or heart disease or whatever, the mini gastric bypass is less time in the surgical room too. Okay, so we consider all the aspects in your health questionnaire to recommend the best procedure. So this next, okay, the duodenal switch, it's very good surgery. It's for special patients who are looking for aggressive weight loss, but who are strict. They need to be strict patients in their follow-up instructions, and the vitamins and protein need to be for all life. Remember, this is extremely strict, like the slide says, vitamins required for life. If you are not considering to take every day and do every 6 months lab test to see how is your level, how are your protein, your hemoglobin, and your albumin, who is the protein to regenerate your tissues. You need to think if you want this surgery. If you are ordained patients, you are disciplined patients, you can consider this surgery, because this surgery is very good. It's resolving all the issues too, the diabetes. We don't have we have a long-term weight loss, of course, and a lot of over 80% of weight loss successful rates, 100% of the successful rates weight loss. But we need to know this is a special surgery for disciplining patients, are more aggressive, are more, it's more time in the surgical room, and repeat your discipline to take the protein and be under supervision by a doctor. It will be necessary for our life. Okay. Okay. The next. Okay. Our return to work or to do physical activity. It's almost the same for all patients and for all surgeries. The desk job, it's no more than 2 weeks. For sure, in 1 week, 1.5 weeks, you will be able to return to that desk job. To walk is actually we start to walk in the first day after surgery. So if you want to walk 1 block out of your house, it will be fine since you come back to your home. And 2-3 weeks, maybe 2-3 blocks. And for workout is 6 weeks at least. Okay. And to lifting, it's 4 to 8 weeks. 6 weeks is the average, but 4 is fine. 15 pounds, it's fine for immediately after surgery, but it's recommendable to try to take care about that and looking for help. Okay. But in 4 to 6 weeks, you will be able to lift more than 15 pounds. If you need to get any paper from your work to get more weeks because you feel it's not enough for you, it's fine. We can do and give you more support in that. Okay. Okay. Since COVID time, we recommend to take precautions to don't get any virus before you come, not strictly the coronavirus, but any other flu situation or, to protect you before you come. It will be very good to don't have any situation. So if you have questions, we will resolve your doubts in the next time. Ron, do you want to say anything?
Yes, I still have some slides to go over. One is for financing. The financing got a little more difficult after the economy kind of tightened up last year, or the interest rates increases. But there are still options out there. Probably the best option is maybe go through your bank, like Bank of America or credit unions. When you have personal relationship with them. If you were to try the providers that we work with, e-financing, United Credit, Super Money, also places like Super Money also are tied to SoFi and all those. Just make sure you don't apply for loan for so many places at one time, because it will hit your credit score and it's not good. Why MBC? MTI insurance coverage. We have this optional coverage for you that you can purchase for $149. This is worth about $300 to $400 package, and we offering it for $149 discounted. So it covers some of the unforeseen situations that you're getting surgery for. And then, last but not least, um, we have bariatric vitamins. That this is the best option for you. That comes in the form of soft chew, chewable, drinkable, and capsule. emergebariatrics.com. You can order this when you are filling out your paperwork with us or after by going to emergebariatrics.com, because it's huge factor. Post-op diet is huge factor. The vitamins are a huge factor. Losing weight by itself is great, but you want to have integrity with your results for years to come, and maybe 7 years out down the line, 8 years down the line. You won't have any problem with bone density or nerve system damage or things like that. So this is proper way of going about it, especially for bypass and DS patients. Now we're gonna go over the questions you guys have. Currently, I have answered 24. I have 67 more. Hopefully, we get time to cover them all. Neri is asking, after I drive to Tijuana, how long takes me to have surgery? So I'm going to repeat that again. So we want you to arrive to the San Diego International Airport. Whether you drive, you can park there and take the shuttle to the airport, or you fly in. There are two terminals in San Diego International Airport. One is practically southwest that they are remodeling, which is a miss, but still, our drivers are always waiting for you before you arrive. They know what time you're coming, and they wait for you basically to get out. Um, so the way it is right now, you just basically, once you get your baggage. And another thing I want to mention is you don't have to um, bring bunch of suitcases. Please try to travel light. So you get your suitcase, you tell the driver when you come out which letter on the curve you are waiting for, and they come and catch you. Basically, there are like alphabetic numbers on the curve. And then if you come with United, American, Delta, all those go to Terminal 2, which is the newer terminal. And again, the same thing, you just get your baggage and you walk out, and the driver is there to catch you and take you to Tijuana. Our facilities is right next to the border, so you are pretty much about half hour, depends on the traffic, you're away from getting to the destination in Tijuana. So once you get there, we do all the pre-op tests, and we would do all the exams. We send you to the hotel to rest for the night. Be ready for the next day. They tell you what time to show up in the lobby. They take you to the hospital. In the hospital, of course, they do exams and all that stuff and get you ready for surgery. You stay, depending on the procedure, for balloon is 1 night, for gastric sleeve 2, bypass and duodenal switch 3. So you stay there that many nights, and then you're ready to go back to San Diego, cross the border, go to San Diego, and catch your flight. And that's why we want your flight to be at 1 or 2 p.m. That's ideal because that gives us enough time to take you out, and you'll be having at least 2 hours before your flight, and you'll be comfortable. You don't have to rush or stress. Again, one thing that I want to mention is when you're going long distance, please make sure you have the compression socks, wear the compression socks, and also don't lift heavy suitcase to put it in the compartment above your seat. Just be careful, and there's always option to stay one more night in the hotel on the San Diego side. We do have a special rate that Hampton Inn has given us. Of course, it keeps going up, but still is a great deal. I think it's at 169 plus tax. and you stay in a beautiful San Diego area next to the airport, and you can enjoy another day or two just hanging around before you go back home. So, again, the Neri is also asking, when do I start drinking before surgery or many special required? So I'm going to let Dr. Valenzuela. So basically, we talked about 2-day clear liquid pre-op diet. No matter what BMI you are, you need to do that 2-day clear liquid. And after, of course, you cannot drink. You can have ice, chips, and things like that. And then once you get your X-ray, and then we make sure, then you go transition from liquid to solid in 4 stages in 1 month. Again, these are all very important to comply with. We do have a nutritionist in our staff. They will be having webinars for pre-op, post-op every month, or at least every 2 weeks. You have access to them by text, email, phone call, and they will be around if you have any question. All the documentation, of course, it gets sent to you, so there shouldn't be anything that is not communicated. And then she's also asking about hair loss. So I'm going to let Dr. Valenzuela talk about hair loss after bariatric surgery.
Okay, that issue, the hair loss, is a fact. After any bariatric surgery, we have acute weight loss time in the first 6 months. And in that time, we have the average is the 30% of our hair loss. We are losing that portion of our volume because we are having this acute time in our weight loss, and we are losing vitamins, we are losing protein, we are losing, but this at the same time we are taking that vitamin, that protein to stop that hair loss. And at the end of the year, we are recovering that hair loss. So we are not going to have a dramatic hair loss if we follow up the recommendation and our protein and vitamins and all vitamins who we need to stop that hair loss, okay? And of course, that is work together, doctors giving you the instructions and the patients taking the vitamin and protein. But yes, we have that time. It's normal, it's part of the recovery time and the acute weight loss, but we will recover that hair in 1 year at most, okay?
Brandon is saying hi to you, Dr. B. So, Brandon, hello. Thank you for attending. Appreciate you time. And it's an honor again for us to work with you today. Yes. Okay, so not to mention messenger no longer current. Okay. So what procedure is best for someone with a BMI of over 50 or 60?
Okay.
Asking.
I tried to explain before, we are seeing what is your all your health questionnaire, if you have acid reflux or not, but the BMI, we recommend if it depends of your age and all that kind of things I explained. If you do a very good pre-op diet and you are not having any problem with acid reflux, bad acid reflux on others who can't get any procedure, of course, our recommendation is to get a malabsorptive procedure. Could be bypass or mini bypass, and but if you want a safety procedure uh, and have good results too, the sleeve surgery, it will be fine. But it depends. If you are the ideal patients with any issue like acid reflux or other condition, you can choose any surgery. But our recommendation is to get a safety surgery, and that depends if you did a very good pre-op diet. We can offer any surgery, and bypass, mini bypass, or gastric sleeve. If you want our recommendations, we need to check your health questionnaire and depends your issues, we will recommend, okay? So I hope you have the good answer. Remember, every patient is different. The BMI is not stop to get any surgery, but if you do a very good pre-op diet, you will be able to get any surgery, and or recommendation, it will be the best for you, depends on your health questionnaire.
So there are some questions about how do I decide what type of surgery is best for me and all that. So basically, once you submit your HQ, whether you select a procedure or not, the surgeon is going to review your HQ based on your situation. They make recommendations, and then also, we try to cover like what's the difference between a sleeve and a bypass, what's the difference between mini bypass and all that. And if you, let's say, take the recommendation and or you selected the type of surgery and you go down to Mexico, there is still time that you have to consult with your surgeon to make sure that's the best procedure for you. And let's say you talk to Dr. V before your surgery and Dr. V say, you know what, I think sleeve is better for you than bypass. That's what you're going to get. So you're not stuck to what we choose for you here. This is just a plan that needs to be confirmed when you're down in Mexico. And the surgical plan is actually determined in Mexico by your surgeon, with you and the surgeon. But of course, it's the more research you do, the better you read, what is the pros and cons, and feel more comfortable, that you have that comfort within your parameter. That's the best. But still, the surgeon is going to tell you. Another thing is this hernia repair. So Dr. Valenzuela can talk about hiatal hernia repair during the surgery, but I just need to chime in first before she starts. It's that our surgeons doesn't just do, let's say if it's a sleeve, just do the sleeve and get out. They will check you for hernia. If it needs to be repaired, they take time to check all that, because if they don't fix the hernia, you have some acid reflux, you have some consequences. But I'll let her explain more of the hiatal hernia repair during the surgery.
Yeah, the hiatal hernia could be surprise in the surgery. Maybe the patients didn't know they have. So we are always repairing that hernias in case the patients have the hiatal hernia. If the patient already knows, of course, we will repair the hernia. If the patients don't have any situation in the hiatus, we won't touch nothing. That it's we are talking all with the patient before they go to the surgery. I always ask if they have or not acid reflux. So I have some idea if the patients go have or not hiatal hernia in the surgical room. And then I explain what will happen in case we found that hiatal hernia. And we repair the hernia in the same procedure all the time because it's important to repair and don't increase the possibility to have acid reflux after surgery. And that is for the hiatal hernia repair. And that exist different others kind of hernia, belly bottom hernia, inguinal hernia that are not included, or we are not repairing that hernias, just hiatal hernia. It's or priority in the surgery. When we found the hernia, we repair all the time the hernia, okay? And I see another question from Brandon Mack.
Okay.
Say how we are seal the stomach in the gastric sleeve surgery. We are doing double seal technique. We do the first in the first plane with the staples, titanium staples, who are the material, ideal material to perform a lot kind of surgeries, not just bariatrics. Could be in an orthopedics, could be in gallbladder removing surgeries. Different surgery is a very taste for many years, many years. That material is not reactive, is not doing reaction in the body of any patient. And we do the first line of staples with this material, closing the sealing the stomach. And the second step is with stitches. The stitches over these staples, so it's double reinforcement in the line of cut in the stomach. So we reduce any possibility, any chance to get any leak with this double reinforced procedure.
So one option is one person is asking, can I go do a sightseeing? So one option is to come one day earlier than you would normally do, which will be 2 days before your surgery. So if you come one day earlier, you can kind of hang out, go see. We do have services that they take you like downtown shopping, downtown Tijuana shopping. I'm doing that. You can also you could basically tell your coordinator, they make arrangement for you to come one day earlier. They make the reservation for hotel and all that. And then you can just, enjoy your day before surgery, before your pre-ops, and then do your that. So
okay, Brandon Baylor says, I have acid reflux, which is the best option for me. For sure is the bypass, okay?
Okay, so which one did you answer?
It's Brandon Baylor.
Brandon. Okay, perfect. Thank you.
For high BMI patients, we need 6 to 8 weeks pre-op diet. That is the best. for Anonymous.
Or do they know switch prices? It's I believe it's over $6,000. So that's Nikki when she's asking. We one of the very few centers that can perform BPD DS or single anastomosis DS, which is called CDS, and our surgeons are well known worldwide for performing DS procedures, and we've been doing it for years. So, how long a patient will be under anesthesia?
Just the time of the surgery. We start the surgery 10 minutes after the anesthesiologist start the anesthesia. We just need 10 minutes to put the clothes over the patients to start the surgery, and then it will be 1 hour 45 minutes the procedure in the sleeve, 1.5 in mini bypass, 2 hours in the revisions or bypass. So that time is under anesthesia plus 10 15 minutes before and after we are cleaning the patients and we are order all the stuff. And then you will be in recovery room, recovering from anesthesia with our anesthesiologist or aftercare patient and with our surgeons close to you, checking your breathing and waking up without problems from anesthesia. You are always under supervision, not with a nurse, with our doctors all the time. So don't worry, the anesthesia is very safety.
Miranda is asking when do I need to stop the medications that I'm taking? Metformin, birth control,
Propranolol and Zyrtec. Okay, the metformin you should to stop when you start the pre-op liquid diet. Okay, that medication, metformin. The birth control need to stop 2 weeks before surgery because the birth control give us a little more risk to get clots. So we are always recommended to stop that birth control and use another birth control thing because we can get hormones in our system when we will have a surgery. So stop the birth control pill. The propranolol is for high blood pressure. You do not need to stop that medication anytime. Actually, you need to continue all days until your surgery. Don't stop anytime. And for anxiety, the pressure, that kind of situations, do not stop the medications. You need to continue. Like we said in the slides, you need to stop aspirin, blood thinners, and anti-inflammatory medications, non-steroids like ibuprofen, naproxen, meloxicam. That kind of medication give us a little more chance to get any bleeding situations. So we recommend all the time to stop at least 1 week before surgery. Okay, it's important.
Now that you're mentioning this, something about people who are taking Ozempic and those semaglutide injectables, we recommend you stop at least 2 weeks, probably even more, before your procedure because it slows down the food movement through your stomach. So when you do your pre-op diet, it's not going to clear completely. So at least a week or two, at least 2 weeks. Another thing I was going to mention was When you go to mexicobariatriccenter.com, we have a lot of these subjects covered. The site is very comprehensive, touching base on all these different issues, but you can find a lot of useful information by going there. One of them is how much weight do I lose? I want Dr. Louisiana to touch this on this subject, but I want to tell you something from our experience here. We see patients that lose all their excess weight. There is no limit of, oh, I only lose 60 pounds, or I lose 100 pounds, I lose 215 pounds. There is no limit. First of all, it's a tool that you acquire, right? So you can work with this tool to get to where you want. It's just a matter of doing the right diet, doing the activity. You the exercise is always good for us. We didn't say, oh, don't do the diet and exercise because it doesn't work. No, we meant for to cure obesity, but we still need to be active. You still need to incorporate activities in your day, like walking, however, you can go to the gym, however you comfortable, you can do it. And also the diet, eating healthy. Of course, after surgery you can't eat the same stuff because your body is going to tell you, hey, I have a new stomach now. But as far as asking how much weight do I lose, that's not, is really a non-issue. And and then another thing is you have to consider is a bypass is a more powerful tool. For sleeve, the first 2 years you're going to lose weight, but then you have to keep it up because you don't have that malabsorption component. So it's a little bit more work, but then you haven't changed anything in your anatomy. Basically, you are just restricting the stomach, and your hormones are reset again. Your metabolic system is reset. But I'll let Dr. Louisiana also touch base on this subject.
Yes, you mentioned right. We have our average to 80% of or excess of weight losing in all kind of bariatric procedure, but some are more successful than 80%. We have 100% in a lot of very successful rare cases, in a lot disciplined patients too. Like you mentioned, this tool, it's a magic. It's a honeymoon the first 2 years, but to maintain after that, you need to work with the tool at the same time, eating and changing your habits to get a new habits with your tool to get all these weight loss for long term and don't regain weight. And of course, the gastric bypass is the best tool because we combine the malabsorption with restriction and we have long-term weight loss. But even with that tool, very, very good tool, we can have at the end of 3, 4, maybe 5 years, a little regain weight if we start to eat sugar. And I saw one question who said, what food are forbidden in the sleep or bypass surgery? I think you need to know it's nothing forbidden. All is permitted, but what do you want to choose to eat? If you want to maintain your weight loss, you need to change your habits. Nothing is forbidden. Of course, we recommend to help eating and to choose first time protein all the time. Protein and the second it's fruit and all healthy food, and of course you can eat rice, you can eat carbs, but not easy carbs, that like chips and that kind, soda and that kind of food are not uh, the good way to maintain your weight loss long term.
Um, so we have like another 100 to go. One I want to try to answer, and we are at the 2 hour mark. So one is that they're saying another center refused to do surgery to them because they had a hanging penis. So and then there were some questions about, oh, if I had a tummy tuck before, or I have scar tissues, can you handle it? So maybe we can kind of touch base on that subject.
Yeah, the scar tissue, it's very common in our practice. We are experts in revisions. Revisions come with all the time with the scar tissue. We know what to expect in every patient. And of course, we explain what will happen in case your scar tissue are strong and very heavy, or if it just removing like others revisions. We remove all the scar tissues we need to remove in the surgery, and we expect scar tissue the more or less, depends what type of surgery you have. And sometimes we have a surprises and big surgeries with mm, uh, very few scar tissue, and small surgery with a lot. It depends too of the reaction of the patients inside, but we know what happened, we know what to do, and we can do almost all. I think we can't perform the surgery in all this time. Maybe I can remember 1 or 2 patients just because the scar tissue do not permit to perform the surgery. So it's not a big problem to perform the surgery. Of course, it's a little more work for us, and we spend a little more time in surgical room. It's a little more percent of maybe a bleeding situation, but we, like I repeat, we can know and we know what to do in that case. Some uh, here person put is 0% of complication in 700 and 7,000 surgeries, and that is not correct. We can't, I repeat, like I said, we can't put 0% of complication. Just the surgeons who do not surgeries have that percent. We have complications because it's part of the statistic and it's part of the life, but our rates are very close to zero because we are very doing with very precaution the surgery, and we take very serious every patient. We took all the rules to perform before, after, and in the recovery time to avoid that possibility. And repeat, we are not saying we are not having any complication, but we are very close to zero, and that is because we have a lot of experience.
Another thing that keeps coming up is excess skin removal. We are a company that is working basically side by side is Mexico Cosmetic Center, mexicocosmeticcenter.com. We do have plastic services we offer with board certified plastic surgeons in Tijuana. So you can go through MCC if you need any of that services. And there was another question I want to touch base is basically they were asking, what is what's the difference between the sleeve you mentioned? Not all surgeons do the same type of sleeve or bypass. So I want to tell you this that the surgeon's skill and experience is huge factor in the success rate and complication rate. So they have their own technique to know what's the best way to cut the stomach or shape the stomach the best for the best result. So you may want to just think about, oh, is a gastric sleeve. No, it depends on the surgeon's too. Okay, so we got to the end and would like to do the raffle, which everyone pretty much was waiting for. I'm sorry, dropped a couple of them. So I'm not gonna look, and I want to make sure it's in the camera. So I will draw one name, and that name is um. So I'm gonna read it. Savannah the White. So let me see if she's still actively there. Okay, let me see. Um, there we go. So I'm gonna let you talk, Savannah. Please speak to us. We like to hear from you. You need to. Okay, there we go. Do you hear it? Do you hear me?
Y- Yes, I do.
Hi. How are you?
Good. I'm wonderful now.
Okay, great. Well, congratulations.
Thank you.
Where do you live? How, tell us about your, share information about you. What's the,
Yes.
how, how are you looking to this procedure and all that?
I live in Spokane, Washington, in the
Wow.
United States,
Okay.
and I'm a single mom to a 4-year-old.
Okay.
I owned a bakery for a long time.
Okay.
Um,
Okay. And how long you
yeah,
been looking to get the procedure?
about 2 years. I've
Wow.
tried just about everything until this, and I looked into it locally, and I did find it even with insurance. The surgery was just kind of unattainable.
Yes. So perfect. So I would have your coordinator contact you and get you set up to go with us. And we hope to see you soon. Dr. Valenzuela is going to be the surgeon to take care of you. Okay? Thank you,
Okay,
everybody,
thank you.
for attending. Thank you, Savannah. And we'll see you the next time. Thank you. Thank you, Dr. V. Thank
Congratulations.
you.
Thank you. Goodbye.
All right. Thank you, guys.